As you know, AI has been incorporated in cardiovascular medicine with a great impact on from research and development and clinical practice and population health. In particular, application of AI to diagnosis is expected to improve the prognosis and QOL of patients with cardiovascular diseases. This slide shows our recent studies reporting the application of AI to detection and diagnosis of various cardiovascular diseases by using various imaging modalities such as ECG, chest X-ray, echocardiography, and coronary angiography, and intravascular ultrasound. We believe that our approach will help the improvement of diagnostic accuracy and prognosis prediction and physician efficiency and efficacy. Today, I'd like to show you two of these studies. One is a deep learning-based approach for detecting signs of atrial septal defect, ASD, on chest radiographs. The other is a deep learning-based age estimation from chest X-rays indicates cardiovascular prognosis. As shown in this slide, the number of cardiac AI in PubMed is exponentially increasing these days. Several disease categories such as atherosclerosis and arrhythmia have been extensively studied in these publications. But some disease categories such as congenital heart disease remain open for our further exploration. You know very much of ASD. ASD is one of the most common adult congenital heart disease. Most ASD patients remain asymptomatic throughout their childhood. But about symptoms such as fatigue, exercise intolerance, and shortness of breath appear with advancing age. And patients with unrepaired ASD ultimately manifest heart failure, pulmonary hypertension, and atrial arrhythmias, leading to the poor QOL and prognosis. Early surgical or transcatheter closure is recommended for ASD patients with substantial shunt flow. It was reported that ASD patients operated after the age of 25 had a significantly lower survival as compared with healthy controls. However, ASD patients operated before the age of 25 had good prognosis that is similar to that of healthy controls. So the early diagnosis and interventions are crucial for improving their prognosis. However, early diagnosis is very difficult and more difficult than imagined in real-world clinical practice. Because ASD patients are occasionally overlooked and undiagnosed for years. It derives from the fact that symptoms and the signs of ASD patients are subtle and non-specific. The chest X-ray findings of ASD patients typically involved cardiomegaly, prominent pulmonary arteries, and increased pulmonary vascular markings. But I think everyone here agrees with me that technical expertise is required for clinicians to suspect ASD on routine chest X-rays. So we hypothesized that AI algorithm can diagnose ASD using chest X-rays, and it would prevent diagnostic delay of ASD when it is implemented in medical checkups. For this purpose, we collected chest X-ray images of both ASD patients and non-ASD patients from our hospital. We selected control as patients who underwent coronary angiography or PCI for the ischemic heart disease, and who are confirmed to have no ASD by echocardiography. And these images are randomly divided into the training set and the test set. Our model was pre-trained by using the large-scale real-world ImageNet data set, followed by the chest X-ray data set released by NIH, followed by a round of training using our ASD training set. We used the convolutional neural network architectures such as VGG16, less than 50, DenseNet 121, and exception. And this slide showed the results of diagnostic performance of models. All models are pre-trained using the ImageNet data set, diagnose ASD with an AUC of 0.90 over 0.90. And ResNet, DenseNet, and exception-based model using pre-trained using a chest X-ray data set also diagnose SD with an AUC of over 0.9. And importantly, the diagnostic performance of our models are comparable to those by the expert cardiologists in our hospital. We also tried to develop an AI algorithm to diagnose ASD using ECG. We found that our model had a certain level of diagnostic performance with an AUC of 0.74. Of course, this AUC is not satisfactory. The specificity is high, but the sensitivity is low. So apparently, the improvement of diagnostic accuracy is needed. So we are trying to improve our diagnostic performance by developing a multimodal model by a combination of various modalities such as ECG and chest X-rays. We are conducting a multi-center study and collecting a larger amount of imaging data of both ASD patients and hereditary controls from multiple hospitals. And we believe that the implementation of our model will provide a solution to reduce the number of ASD patients who are otherwise overlooked or undiagnosed for years. Okay, let's move on to the next topic, deep learning-based age estimation from chest rates. We Japanese also use Chinese characters we called kanji. The Chinese kanji has multiple components. The component conveying lexical meaning is called radical. These characters mean the age or aging in English. I'm wondering why these characters meaning age have the tooth or teeth radical. I think it is because the number of teeth, both in China and in Japan, has traditionally symbolized the physical changes occurring with age. So the number of teeth is a biological age. The cardiac functions also declines with advancing chronological age, but it remains unknown how to estimate biological heart age, cardiac age. Chest X-ray provides a lot of information about the heart and heart function. And the chest X-ray changes with advancing age. So we hypothesize that we can estimate cardiac age from chest X-rays using the deep learning. This slide shows the outline of our study. Our model was pre-trained using the ImageNet data set and trained to estimate age by using the NIH chest X-ray data set. And the validation data from NIH data set and also independent and external JSRT database were used to estimate diagnostic performance. As shown this slide, chest X-ray estimated by our model showed a strong and significant correlation with chronological age. The mean absolute error between the chest X-ray age and chronological age was 3.9 years in the test data set. And that was 4.9 years in the independent data sets. When we compare the diagnostic performance of our model with those by human 4 expert physicians and 3 expert radiologists, as you can see, the mean absolute error by our model was 4.9 years, but that by physicians or radiologists was 10.7 years. So these results indicate that our model estimation of age was much more accurate than that by physicians or radiologists. And we next estimated age by our model using the prospective heart failure registry. And the chest X-ray age estimated by our model of patients, heart failure patients who had hypertension or atrial fibrillation was significantly higher than their chronological age. And similarly, the older chest X-ray age was significantly associated with higher heart rate, diastolic blood pressure, NT-proBNP level, and LA dimension. So we think that the chest X-ray age was associated with comorbidities and heart failure patients. And more importantly, chest X-ray age was associated with heart failure outcome. Heart failure patients estimated to be older than their chronological age had worse prognosis. And the age gap, which is the difference between the chest X-ray age and chronological age, was independently associated with the primary outcome, composite endpoint of all-cause death and heart failure rehospitalization. There have been several papers demonstrating that age can be estimated by ECG. And ECG age also serves as an indicator or predictor for mortality in the general population. So we assume that age can be estimated from other imaging modalities such as echocardiography and cardiac MRI. And the chest X-ray integration of our chest X-ray age with those biological ages in combination of demographic and clinical data or lifestyle factors will enable us to estimate the more accurate cardiac age, which will serve as a biomarker for prediction of prognosis of cardiovascular diseases or cardiac aging. So in conclusion, AI enables us to estimate patients' age and to detect signs of cardiovascular diseases using chest X-ray. And AI will provide us a novel and useful biomarker, which serves as an indicator for cardiovascular diseases and aging. And AI in cardiovascular care is expected to enable early, rapid, and highly accurate diagnosis to improve the quality of medical care and streamline tasks by reducing the burden on clinicians. Thank you for attention. 谢谢。